I'm going to talk you through how to use a pocket face mask. So we use this when we're giving CPR to a casualty who is not breathing. It helps to stop the transmission of diseases and also contact with bodily fluids. You find these in clinical areas and community care settings as well, for example, care homes. Not always in the first aid box, but they should be available to help reduce that risk of transmission. They should be sealed, so when you open it, you're actually breaking the seal. So when you open it, this is how it looks like. Take it out, and you need to push this out like that. So this actually fits in onto the face to cover both the nose and the mouth. And this side is really squeegee. When you put it around the face and the mouth, it should be able to seal so that when you give the rescue breaths, the air stays in there and goes through to hopefully go into the lungs. It's got a valve that stops any fluids coming back to you. So it's a one-way valve. Again, that increases the protection, but also it controls that air that you're pushing in to get into the victim where they need it the most. So it will cover the nose, so the bridge of the nose fits the shape of the bridge of the nose fits nicely into this. So if I show on myself, it's like this. So as I'm breathing in, I can actually feel the air collecting in there. And that's what you want really for the victim. So when you blow the air in, it's going straight into their mouth and into the lungs. So we do head tilt chin lift to open the airway. Then you place this on. So you don't want to push it like that. When you actually lift the head and chin like this, it actually pushes into the mask itself rather than you pushing the mask against the person. So it can be a little bit awkward how you hold it, but what I tend to do is I put one finger holding the mask itself, then the other two fingers just around the chin, and the third finger a little bit further down, so that I maintain the airway and this seal remains closed, and I'm able now to blow into their mouth, and you can see the chest rising with every breath that I give them. So you give your 2 rescue breaths and you go back to carry on your chest compressions. That's how we use the pocket face mask during CPR to stop the transmission of diseases and also contact with body fluids.